Imagine you have a cough, a nagging cough, that just won't quit, despite all the usual remedies. It lingers, day after day, and your doctor decides it's time to investigate further. Your doctor takes a tiny tissue sample, a biopsy, from your airway to get a closer look at what might be causing the problem. This is a crucial step in identifying the root cause of your persistent symptoms and sends it to the lab for careful analysis. The sample is carefully packaged and transported, ensuring its integrity for the tests to come. Days later, after meticulous examination, your doctor knows exactly what's wrong, right down to the cellular level, providing a precise diagnosis. This detailed understanding doesn't come from a scan, like an X-ray or MRI, or a routine blood test, but from histology, the specialized study of tissues under the microscope, revealing intricate details invisible to the naked eye. Histology is a detective's tool, a powerful method for uncovering hidden truths within our bodies, revealing crucial clues in the shapes and patterns of our cells, offering insights into their function and health. Every function in our bodies, breathing, healing, thinking, all the processes that keep us alive and functioning, begins at this fundamental microscopic level, where cells interact and perform their specific roles. For medical students embarking on their journey to become healthcare professionals, histology is their first deep dive into the body's inner workings, providing a foundational understanding of human biology. They learn to see not just colors and patterns on the slides, but the intricate story of how cells work together in harmony to form tissues and organs. At first glance, histology slides might look like abstract art, a kaleidoscope of colors and shapes. But soon, with careful observation, recognizable patterns emerge, the neat, organized rows of skin cells, forming a protective barrier, the complex branching neurons of the brain, responsible for thought and communication. Students discover that a cell's structure is intimately linked to its job, its form dictating its function. This critical skill, translating microscopic images into comprehensive stories of health and disease, turns dedicated students into skilled doctors, ready to serve their communities, who can make informed, life-saving diagnoses based on the subtle clues hidden within tissues. The journey into histology is the crucial first step, the foundation upon which they build their understanding of how to effectively treat and combat disease. So what exactly is histology? What does it entail? It's the study of tissues, those intricate building blocks of our organs, but we examine them at the microscopic level. We delve into the minute details that make up the larger structures. If gross anatomy, which you can see with the naked eye, is like having a city map, showing you the roads and major landmarks, histology zooms way in, allowing us to see the individual bricks that make up the buildings and the people moving inside those buildings. It's a much more granular view. Doctors collect tiny tissue samples, biopsies, from patients. Then in the lab, technicians meticulously slice and stain them. This staining process is crucial, as it allows the cells to become visible and distinguishable under the microscope. These stains, often a combination of pink and purple hues, highlight the cell's nucleus, the control center, and other vital structures, essentially turning the tissue into a vivid, readable story. Medical students dedicate countless hours learning to interpret these slides, carefully connecting what they observe under the microscope to the intricate workings of the human body. Why does all of this matter so much? Because fundamentally, disease often starts at the cellular level. A tumor, for instance, is simply a mass of cells growing abnormally and uncontrollably. And an infection signifies an invasion of harmful bacteria or an overzealous response from our own immune cells. By meticulously examining tissue samples, a pathologist, a specialized doctor, can spot these subtle changes and ultimately guide the course of treatment. Therefore, histology is absolutely essential for making accurate diagnoses and providing effective patient care. In essence, it serves as the very foundation upon which much of modern medicine is built. Our bodies, in their incredible complexity, are fundamentally built from just 4 main tissue types. These tissues represent the foundational materials that construct every organ and system within us. Each tissue type possesses a unique structure and, consequently, a unique role to play in maintaining our health and function. Epithelial tissue is designed to cover and line surfaces throughout the body. Think of it like skin, our protective barrier, and the lining of your gut, where nutrients are absorbed. It's all about protecting underlying structures and facilitating absorption of essential substances. Under the microscope, epithelial cells often appear to form neat, organized layers, reflecting their protective function. Sometimes, these cells even feature fuzzy microvilli, tiny projections that significantly boost the surface area for absorption. Connective tissue, as the name suggests, supports and connects everything within us. This includes bone, cartilage, fat, and blood, each playing a vital role. Its cells are typically scattered within a matrix composed of fibers, providing structural integrity. This matrix gives strength and support, or flexibility and movement, depending on the tissue's function. A great example is the web of areolar tissue found just under your skin. Collagen fibers are responsible for providing tensile strength, resisting pulling forces, while elastic fibers allow tissues to stretch and recoil, returning to their original shape. The specific structure of each tissue is perfectly matched to its intended job within the body. This ranges from holding organs securely in place to facilitating the passage of vital nutrients. Ultimately, these tissues are the fundamental building blocks that come together to form every organ in your body. Therefore, understanding the characteristics and functions of these tissues is absolutely key to understanding the human body as a whole. Muscle tissue powers every movement, from walking to your heartbeat. There are 3 types: skeletal, voluntary movement; smooth, organs; and cardiac, heart. Under the microscope, skeletal muscle shows striped fibers for quick, strong contractions. Nervous tissue forms the brain, spinal cord, and nerves. Our body's communication network. Neurons, with their star-shaped bodies and branching axons, transmit signals. Glial cells support them. These networks control everything from thoughts to reflexes. Seeing these tissues under the microscope reveals the complexity behind every action and sensation. Histology shows how structure and function are inseparable. Knowing healthy tissue is just the start. Histology's real power is revealing disease. Every illness leaves a cellular signature. By comparing healthy and diseased tissue, pathologists diagnose and guide treatment. Take celiac disease under the microscope. The intestines villi are flattened, explaining symptoms and guiding a gluten-free diet. In cancer, histology identifies the type and aggressiveness, shaping treatment plans. Without histology, medicine would be guesswork. It lets doctors target disease at its source. For medical students, histology bridges basic science and clinical care. It teaches that illness is a disruption of the body's intricate cellular design. From infections to cancer, reading the stories in our cells is a life-saving skill. Histology is the visual foundation of modern medicine.